If your doctor said you have a disc problem and you weren't sure what that really meant, this video is for you. A disc, also called an intervertebral disc, is a soft cushion between the bones of your spine. It acts like a shock absorber, helping your spine bend and twist and handle everyday movement. Over time or after an injury, a disc can wear down, bulge, or tear. When that happens, it may lose some of its cushioning or press on a nearby nerve. That's when symptoms like pain, tingling, or numbness can show up. But pain doesn't always come from a nerve. Sometimes the pain comes directly from the disc itself. Small tears and inflammation inside the disc can make it pain sensitive, causing a deep aching pain that stays centered in the spine even when no nerve is being pinched. Disc problems feel different depending on where they happen. In the neck, a disc issue may cause neck pain or symptoms that travel into the shoulder, arm, or hand. In the middle back, which is naturally more stable because of the rib cage, disc problems are less common, but when they do occur, pain may wrap around the chest or the ribs and feel like a tight band. Disc issues are most common in the lower back and may cause low back pain or pain that travels down the leg. One key thing to know, not every disc change causes symptoms. Many people have disc bulges on MRI and feel perfectly fine. What matters is whether the disc is inflamed, irritating a nerve, and whether your symptoms match what's seen on imaging. Helpful questions to ask your doctor are things like, is my pain coming from the disc itself or from a nerve it's touching? And is this something that can be improved without surgery? Disc bulge. A disc bulge means that the cushion between your bones of your spine has shifted or pushed outward, but the outer layer of the disc is still intact. Think of it like a tire that's slightly flattened on one side rather than popped. A disc bulge often develops gradually over time from normal wear and tear, posture, or repeated stress. Many disc bulges do not cause pain at all and are commonly seen on MRI, even in people who feel perfectly fine. When symptoms do occur, they depend on what the bulge is touching. If the bulge presses on a nearby nerve, it can cause pain, tingling, or numbness. If it doesn't affect a nerve, it may cause little to no symptoms. Disc bulges feel different depending on where they happen. In the neck, a disc bulge may cause neck pain or symptoms that travel into the shoulder, arm, or hand. In the middle back, disc bulges are less common, but when they do cause symptoms, pain may wrap around the chest or ribs and feel like a tight band. In the lower back, disc bulges are very common and may cause low back pain or pain that travels into the buttocks or legs. One key thing to know, a disc bulge is not the same as a herniation, and it does not automatically mean surgery is needed. What matters most is whether the bulge is irritating a nerve or whether your symptoms match what's seen on imaging. Helpful questions to ask your doctor are, is the disc bulge actually touching a nerve? And is this something that can be improved with time or conservative treatment? Disc herniation. A disc herniation happens when the cushion between the bones of your spine tears and allows the inner material to push outward. If anybody had a Stretch Armstrong doll and you saw that inside kind of push out, that's pretty much what it is. Unlike a disc bulge, a herniation means the outer layer of the disc has been disrupted. Disc herniations may occur suddenly after a strain or injury or gradually as the disc weakens over time. When the inner disc material pushes outward, it can irritate nearby nerves or cause inflammation, leading to pain, tingling, numbness, or weakness. Disc herniations feel different depending on where they happen. In the neck, a disc herniation may cause neck pain or symptoms that travel into the shoulder, arm, or hand, sometimes affecting grip strength or coordination. In the middle back, disc herniations are less common, but when they do occur, symptoms may include pain or nerve sensations that wrap around the chest or the ribs and feel like a tight band. In the lower back, disc herniations are most common. It may cause low back pain or pain that travels into the buttock, leg, or foot. One key thing to note, not all disc herniations require surgery. Many improve with time and conservative treatment as inflammation settles and the disc heals. What matters most is whether the herniation is compressing on a nerve or the spinal cord, and whether your symptoms match what's seen on imaging. Helpful questions to ask your doctor are, is the herniation pressing on a nerve or the spinal cord? And what signs would suggest this needs more urgent treatment? Nerve compression or pinched nerve. Nerve compression, often called a pinched nerve, happens when a spinal nerve is pressed or irritated by nearby structures like a disc, bone, or swelling. When a nerve is compressed, it can't send signals normally. This can lead to sharp pain, burning, tingling, numbness, or weakness, often felt away from the spine along the path of the nerve. Pinched nerve symptoms depend on where the nerve is affected. In the neck, nerve compression may cause pain, tingling, or weakness that travels into the shoulder, the arm, or the hand. In the middle back, nerve compression may cause pain or unusual sensations that wrap around the chest or ribs, sometimes feeling like a tight band. In the lower back, nerve compression commonly causes pain that travels into the buttock, leg, or foot, and may be accompanied by weakness or numbness. One thing to know, nerve compression doesn't always require surgery. Many cases improve as inflammation settles and pressure on the nerve decreases. What matters most is how severe the compression is, how long symptoms have been present, and whether weakness is progressing. Helpful questions to ask your doctor are things like, which nerve is being affected, and is this likely to improve with conservative treatment, or does it need more urgent care? This has been the Brit Factor with Bonafide, and thank you for learning with me.